Hi everyone. I am so excited. We get to do another story of hope. And before we started recording, the first thing Crystal said to me was, it's gonna make me cry, like how happy she is to be here because she feels like she manifested this. This was always your vision, right? This is what
Right.
helped you. I think part of your visions to
Yeah.
get there was seeing you doing a story of hope with me at some point. And
Yeah.
yeah, and now she's completely on the other side. She has how old is your little one?
4 months. She's,
4 months. She's 4 months old, healthy, fat baby, like you just
yes.
said. And so when you did one of the, yeah, you joined my functional fertility group coaching program. That's the 6 month program that we have. And
Yes.
right when you joined, you were actually miscarrying, right? Why don't you
Yeah.
share that part of the story? So
Yeah. So I had found your books. I believe it was in the summer of 2022. And I had read I knew well, I was struggling with secondary for infertility. I had an older child, but I struggled with her as well to have her. And I had been having some health issues, and I knew that this second one was going to be a lot more challenging because in 2019 I had been diagnosed with Lyme disease, and then I knew I had stage 4 endometriosis. So I'm like, I'm going to need extra help. This isn't working. We've been trying for a couple years. So I had found your book, the one 2020, 2022, Yes, You Can Get Pregnant. And I read that one, and it started to help me tremendously with my health overall, which is one of the first things I noticed. So I was like, okay, well, if I never have another child, my health is getting a lot better.
how
Um,
old were you at this time? Sorry, you came.
let's see. So I'm 30, I just turned 38. So this is, I think I was
Yeah,
36.
36,
I was
35.
36.
Yeah.
Yeah, and so started feeling better. We did get pregnant in October of that year, just based off of your advice from that book. But there was something missing because I quickly miscarried in the fall of 2022. So then we just kept trying. We're like, we're gonna try again. And then I miscarried a second time pretty quickly after that. But this one lasted longer. So this one was definitely more traumatic for me because I had to have surgery. So this one took, so that's when I reached out to you. I'm like, your books are working. Everything, something was missing. Everything was coming together, but then something was missing. And so I thought, okay, well, let me reach out to her. And at that time we were kind of going in between, like, okay, we have the fertility doctors telling us one thing, which I was seeing a different one at the time, who told me I couldn't get pregnant without IVF. And yet here I was, after reading your books, getting pregnant with one block tube. And so it was pretty miraculous. So I'm like, okay, obviously this woman knows what she's talking about. Let me talk to her. And I'm not gonna lie, at first, like, my husband, we looked at the price and we were like, I don't know. And I will tell anybody now, I tell anyone, I'm like, it's worth it times 10. But because overall, like, even my postpartum has been so much better than it was with my first child. So anyway, so all that said, let's see. So I called you, I think we were like voice messaging through email, right? And
Because usually you apply to the program
mhm,
and um, I think you didn't maybe know you were pregnant during the application. Then I reviewed your application, I accepted you, then you found out you were pregnant
and then miss,
or you were miscarrying.
yes.
And so even before your program started, we were communicating and I was giving you
Exactly.
advice on what steps were next. And I think too, based on, I think it's just important for everybody to know too, in this pregnancy, that third one that she miscarried, she did conceive naturally and you were on extra progesterone and you were taking a baby aspirin
I was still
and she
still miscarried.
still miscarried. And
Right.
but yeah, our work together started off with a lot of frenzy. I mean, it was
Right.
really overwhelming.
Traumatic. I mean, I was in the
For
middle of a traumatic situation.
super traumatic. And then I think the doctor wanted to put you on the pill to start to regulate things. If you remember that, you had a really bad reaction to the pill.
Yeah.
But we really hit the ground running. And also, like, it was really clear to me that Crystal could get pregnant naturally, but
Mhm.
yet her doctors were saying IVF with PGT testing, right? With testing the embryos was the only option for you.
Right. And at first, I mean, even before your books, I'll say this, before I had read your books, I remember leaving one fertility clinic crying because they said, well, you have a blocked tube and you have stage 4 endometriosis. And they likened it to cancer. The doctor that I said, she said, this is like a cancer and you're not going to get pregnant on your own. She said, you needed IVF like yesterday. And I just left devastated, so, and then I picked up your books and started to get pregnant on my own. Of course, it took me I think about 8 months after applying the information that you had in there, especially adding extra protein in my diet, things like that, then things started to happen. But again, when we met, I was in the middle of a miscarriage.
That was miscarriage number 3.
Yes, I think I was bleeding, but I had not yet had my DNC. So then when they went in, I think one of the game changers for me was something that you recommended, which was something no one had recommended, because nothing was showing up on my ultrasounds. My ultrasounds looked perfect, but when they went in for the DNC, you recommended they do a hysteroscopy as well. And even my doctor at the time, he was super sweet, but he was like, I really don't think you need one. We're just going to do a DNC. Everything looks good on the ultrasound, but he said, we'll go ahead and do it, if that's what you want. It was something you mentioned. And so he came to me when I woke up from surgery and said he was so glad that we did it, because I had tiny polyps everywhere and they were blocking the entrance of my uterus. And he said he really thought that it was possibly affecting implantation.
Right.
And he explained it like saying like that they can starve the embryo of oxygen
That's
in the
right.
beginning. And
And
so
blood flow.
blood
And so
flow.
then it just doesn't grow, and then it will miscarry, right?
Right.
And so, and that's why I pointed out too with the baby aspirin, we're often recommending baby aspirin with losses because of how it helps with blood flow and circulation. But in your case too, looking at the uterine environment, which regardless, if you had come to me even after that 3rd miscarriage, my first course of action would have been a hysteroscopy, right? It was
Right.
just like the timing worked out for us that you were, obviously it sucked that you were miscarrying, but that you were going under for the DNC. Let's kill 2 birds with 1 stone. Let's get the hysteroscopy done. And then we went into recovery mode, right? To recover from yet another miscarriage and deal with the
Yeah.
trauma of that and like what was going on. But I think one thing to point out too is that we discussed doing autoimmune testing with you because
Mhm.
of the history of Lyme and the endometriosis. But there were so many things like I think you should talk about too of like when you healed your Lyme, you didn't know me then. And that was significant. And so when Crystal came to me, your diet was like spectacular. And you had a spectacular regimen of supplements. You'd done tons of nervous system work. So I mean, there were so many things already in place. But I don't know, maybe talk about that a bit too, because I think you were exceptionally healthy considering everything you'd been through.
Yeah, and I think sometimes that's why the missing piece can be nervous system related when you're already doing like a really good organic diet. I will say it wasn't as good as it could have been on the protein side, which is something you emphasized heavily. I was eating very clean and very plant-based, but and I had actually been working previously. I don't know if we talked about this, like way before I had even talked to another fertility coach who had put me on a strictly plant-based diet, and that
Right. I
wasn't
do remember that.
yeah,
Wasn't
that
for you.
wasn't
Was
working
not for
for
you.
me. It
Yeah.
wasn't working for me. And so when I started reading your books and then doing the more, protein and meat-based diet, grass-fed meats and organ meats and stuff like that, organ supplements, that's when things started coming together for me. So, yeah, I had done a lot of healing from the Lyme previously. And I think that it's a whole different animal, but I hear a lot of women in the Lyme community say like, oh, I can't get pregnant because I can give the baby Lyme, or my body, my eggs are too damaged, because that's what we're told. That's what the medical community tells us, that Lyme and
Crazy.
endometriosis, I was
Wow.
told, had totally destroyed my egg quality. And my AMH, if I can speak on that a little bit, my
Yeah.
AMH was a 0.4.
Right.
And my FSH was a 29 when they checked it. Let's see, I think they checked it right after sometime around that last miscarriage.
Yeah.
And
And I
so
remember saying I didn't think it was an accurate time to
an
test,
accurate reading. Yeah. So, but what's really interesting is
but
some
it
of the,
was high and
it was
AMH
high.
was low, especially for
Yeah.
your age. You're 36 at the time, 37 at the time, right? So that's a
Yeah.
low AMH for your age. So yeah.
And my follicle count wasn't so great. I mean, it was like maybe 2 to 3 follicles a month, which was okay for that age, but I really should have had more. They really wanted to see like 6 or 7 for late 30s, and I think that was something that was, I didn't really recognize how much improvement could have been made until I started making that improvement. So where things started to get really better is when I joined your program. So I joined the community of women. I will say I was like happy for the other women who got pregnant in the group, but also sad because it was like,
Hard.
but I think there's statistics that show, and you can probably speak on this, but like when you're in a group of women like that, like you're more likely to get pregnant.
The statistics show 50% higher chance of getting pregnant when you're in a support group. And I would add when you're active in a support group, not
Yeah,
just joining one. And you were
right.
active and you would ask questions and you showed up every week and
Yeah,
you did all the things. You
and I
really
did my
did.
homework.
Yeah, you did
Yeah.
your homework. You did. You
Mhm.
did. And we see the best success with our girls that do all that, you know. And
Yeah,
so also after the miscarriage, right? They then are pushing you to do IVF. We decide to do IUIs, right? But
right.
I think you did 2 or 3 IUIs and you had
I
a
think I
cyst at
did.
one point,
I've done
right?
2 in total, yeah, and then I ended up having a cyst. Okay, let me talk on that cyst for a second, because a lot
Yeah,
of and then in this biohacking community, which I'm all about, but they're telling us to do these cold plunges, right? Cold
right.
showers, cold plunges, cold, cold, cold. Well, I thought, let me, and this wasn't something you recommended, but from watching all these Instagram videos, I thought, let me start taking ice cold showers. So I started doing that, and that is when I developed that cyst. And so it's my theory, I guess anecdotally, that that coldness really stresses the body out, especially when you're trying to be fertile. And so it was like my
And it
body was,
congeals. It
yeah,
congeals. And so I think there's space for it, but
yeah,
not, not, and the Chinese medicine were like all about warmth for blood
right,
flow and circulation and flow, flow, flow.
yeah,
And yeah, I think it was was not the best thing for you. And I remember I'm like looking at our notes now too, was like
it's super
uh
important. I think that you pay, because you recommended, acupuncture. So I started going weekly, and I found a
right.
really great guy here in town who started doing my,
That's
my
right.
acupuncture sessions. And he was like, you want to keep those organs as warm as possible. You want to keep socks on all the
That's
time,
right.
which,
Wear socks, eat warm
you know,
foods, nettle tea, raspberry tea, right? We were doing all those.
yeah. So I kind of set myself back with those ice cold showers. So after, I think so then you got me on the castor oil packs, and I got rid of that cyst. So that went away, even though they told me it may not go away, blah, blah, blah. They always have like a different, the Western medicine route of it can be great, but it can also be, not the best advice, because they even had suggested doing like a surgical removal of it, which
Right.
none of that was necessary, because I think we did castor oil packs for two cycles and it was gone.
And then
Um,
also we will add, and we talked about this before we got on, that you were on I you were on the Wob enzyme, I think already before I
but,
met you, which is my favorite serapeptase. And then
uh-huh.
you were also on
Seredia.
Tia, 6 capsules a
Yeah.
day,
Mhm.
Seredia, and then Nadovina. So you were on like 3 different proteolytic enzymes, correct?
Yes, but I bumped them up when I found that cyst. When they found that, we increased everything. And I had taken Wobenzyme in the past, like years ago, but you reminded me of it. And I never took it in the therapeutic doses that I did while working with you. So I ended up taking Wobenzyme throughout pregnancy as well.
Which
So
I do think, I mean, I know we're jumping around, but like,
yeah.
um, we know that there's small studies, but they are showing women with recurrent pregnancy loss
Mhm.
adding in the Wob enzyme, and then we also added in one other thing that we'll talk about, the
Yeah.
LDN. I
Mhm.
think those 2 things made such a big difference for you.
Huge. Yeah, huge. So like it was around, I guess this was early spring, so like March when I had my DNC, if I remember correctly, of last year of 2023. And then we were already now we're in contact. I joined the program, we're working together, and it's really just this all inclusive kind of encompassing, where I will say, like, I've never met anybody like you, because your group is so wonderful, and that like everyone's always checking on you, and it's like it's just so good natured. Like it's really truly, there are fertility coaches out there who are like, if you don't work with me, you're not going to have a baby and it's going to be on you, they're that kind of, and it's not like that here. And so that's what I loved, because you recommended, hey, continue to work through the grieving process of the miscarriages. So I found a therapist, and then my therapist on the ground she's incredible as well. And she helped me and asked about you. And she was very intrigued by the whole process of what I was going through with you. And then you recommended LDN on one of our calls, low dose naltrexone, if I can talk on that a little bit. So
Totally do it. Yeah.
yeah, so that was something I had heard about in the Lyme community, and a lot of people with autoimmune kind of issues take it for a while, but they get on such a high dose and they have what's called like a Herx reaction or a die-off of symptoms, that they get afraid and they stop it. And you see a lot of that. And so it wasn't something that was at the top of my to-do list to try. But when you mentioned it and doing it at a very low, like we started at a 1.5 milligrams a day. I worked myself up to 3. Finally, I was at 4.5
4.5.
milligrams a day. Yeah. And I will say I did not tell my doctor about this. This was my personal decision. I didn't want to tell him because, well, when I first brought it up to him, he had no idea what it was. But I had done enough research and looked at all the YouTube videos out there and seen that they were using it for infertility, and you had mentioned it for inflammation. And so I said, okay, let's try this. So here's where I know it worked, because my follicle count was at a 2 or 3 when I started it. Every month I was getting 2 to 3 follicles. Then about 6 weeks after I started it, if Joe's in the room, he might remember, because I went up from like 2 to 3 follicles to 4 to 6. And then the month that I conceived naturally, which we'll get to, I ended up having nine follicles. Was it 7 or 9, Joe? Sorry, my husband's. I think it was 7 or 9. So, but it was a
I could
lot. It was
probably
like,
find it too in our email thread. But I
yeah,
remember that too, of like, and I kept thinking like, and so my train of thought too, and I know you and I discussed it too, of like taking it consistently over a long period of time slowly lowers that inflammation, plus adding in the proteolytic enzymes,
yeah.
plus the diet, plus all the life. You did a ton of lifestyle stuff, like her, time in nature and her journaling and prayer was a big
Oh
part
yeah.
of your lifestyle. I mean, and so much support. You have a great supportive partner. And, I think you really took on that side of it. But like what we started to see was healthier blood flow, healthier blood flow, healthier blood flow. Ovaries
Right.
started coming back to life, responding. I also think getting rid of that cyst, which was
Yeah.
problematic. And then ovarian health kind of came up and everything really blossomed in there.
Yeah, no, it was truthfully, it was amazing. And people, my friends even, I just saw one of them who came into town last week, and she's like, you're like a different person. I mean, because she herself had suffered from endometriosis and ended up having surgery. And she had recommended that, as a well-meaning friend, when I was going through the thick of it, she's like, maybe just get everything removed and your problems might get a lot better. But I'm a very stubborn person. And I said, no, I'm gonna have another baby,
I
and
think committed. I don't think
yeah,
stubborn.
stubborn, determined, very
But
determined.
when we talked about it too, like I have an email here where it was like the AMH really trips me up, or this is probably one of our coaching sessions,
Mm,
and the endo. And you would always come back to this thing with me of like, did you have women? How many women? Tell me
yeah,
about the women that had stage 4 with my
yeah,
AMH and did it. And I was like, well, we got lots, and
yeah,
but it was like consistency and frequency, right? I remember always coming back to you with that of like consistency and frequency. Let's stay the course. Let's stay the course.
yeah,
And then I remember your period, August 7th, last menstrual cycle was essentially painless. Color was beautiful. Clots are gone.
yeah,
LDN has made such a difference. Your sleep, you were tracking your HRV so much better. You
yeah,
were already thinking about the next pregnancy. Will I stay on LDN in the pregnancy? But then the fears would come up, like, am I ever going to get pregnant again? You hadn't been pregnant now since January, and now it's
right,
August, 8 months. And prior to that, it was October and then January, so it was closer together. There was a
yeah.
lot of,
So
the
emotionally, I wasn't doing well right at that moment. So my
weren't.
health has gotten a lot better, but I was kind of spiraling because of the time. My birthday was coming up again. And I thought, I had put all these time constraints on myself. And so I think for any women out there who feel like I've been trying this for too long, like right when you feel like you can't do this anymore, you're usually right, very close. And so we were very close, and you stuck with me.
Were because it was the next cycle. I mean, I'll
Yeah.
read the email.
Yeah.
Amy, 4 exclamation points, August 25th. What on earth? And there was a picture attached of a positive pregnancy test. My IUI was canceled this month, and I did not take a trigger shot. I was sick with COVID.
Hmm.
Yesterday I had coffee, which I never drink. And last night, since I already knew I wasn't pregnant, I had a margarita. I hope you don't mind me sharing that.
That's
This
fine.
morning I took a test because tonight we're going to a comedy club and I wanted to know if I was pregnant or not. I thought we were going to do an IVF cycle, so I figured, I just take some time and enjoy myself, and took a test this morning and look. And then, of course, you were worried. I feel like I screwed everything up. I called my doctor. They assured I didn't. I, of course, assured you didn't. And I would assure everyone out there you can have, you
Yeah,
know, um,
she's
a
perfectly
cocktail
fine.
and exactly and get
Yeah,
pregnant. And everything, it's like before the placenta. Anyway, I wouldn't even worry about it. It happens all the time. But, and then you said, I said, oh my God, this is amazing. I said, you did not screw anything up. Go in for blood work, fill me in ASAP, get your beta, progesterone, TSH. And then you said, I hope in a year from now, which I think is so interesting because it's a little over a year. I
yeah,
can come on your social with you and tell my story. You know that I'm obsessed with tea. Tell me what's safe to drink. But anyway, I mean, I think, and then that pregnancy obviously
yeah,
came all the way to fruition. Which it
Yeah.
was also in the beginning. I mean, you had some spotting. I mean, there was some
Oh,
scary
yeah.
stuff too in there, if you want to talk about that.
Yeah, so I think so I had two subchorionic hematomas, which were terrifying because I bled more in this pregnancy than I've ever bled. And I did bleed a little bit with my 7-year-old, but this was a lot and for weeks. And so they had kind of put me on very low activity, like don't, because every time I moved around, I would bleed. And so I think I emailed, called, or messaged you several times panicking.
But
And
talk about what you did, because now it's my standard recommendation because of you and you taught me.
So I stayed up day and night researching what the hell can I do to get this baby to stick. And I came across something on TikTok, and it was I think a midwife who was sharing that alpha lipoic, there's actual medical
There is. You
journals
shared the
that
research with me. Yep.
prove that alpha lipoic acid will save high risk pregnancies if they're viable. If there's nothing wrong with the pregnancy, it can seal that blood and stop the bleeding. So I had been bleeding for 10 weeks and got on alpha lipoic acid, and within 48 hours, I never bled again. It was done. And I did go to my doctor, and I do love him. So I don't say this to knock any of his expertise, but he goes, well, it could have been a fluke. It's like, it could have been a coincidence. And I'm like,
But
well,
we've had two similar cases with history of losses, then the subchorionic hematoma. And the subchorionic hematomas are more likely in women on the baby aspirin just because it thins the blood. So there's like that layer. But we're
yeah.
not going to stop the baby aspirin because we're thinking it's helping the pregnancy. But we've had two cases since, maybe three. And anyway, same thing, alpha lipoic acid, every single one of them helped with the subchorionic hematoma and the 600 milligrams. I mean, you shared that research paper with me. I, of course, read it, then did more
Yeah.
research, and of course, okayed it for you. And then since we have seen it clinically be very effective for
And
exactly what we're dealing with. Yeah.
I stayed on it the whole time because I mean it's an antioxidant, so I just chose to stay on it. And I'd skip here a day or two just after I had stopped bleeding and things were good. I'd maybe skip the weekends because it's not a cheap supplement by any stretch.
No.
But I
And
stayed on
then the other thing too that you stayed on the serapeptases through the pregnancy, right?
the Wobenzyme. Yeah, I stayed on
Enzyme
Wobenzyme.
and the LDN. So maybe talk about
Okay.
that too. We went down to the 3, I think, and then
Oh,
stayed
I
on
did.
it till
Yep.
37.
Yeah,
Yeah.
so I decided, and you said, it's up to you. It's totally your choice of what you want to do. There's not a lot of research out there that I could find that shows either way, what to do. So I just kind of made the executive decision that I was going to stay on it because what did I have to lose? And so I stayed on it till week 37. I got off because you cannot have any pain medication. Pain medication won't work. So in the event I needed a C-section or something, I needed to be off of it. So got off of it at week 37. And then at week 40, my baby still wasn't here. She liked it in there. So anyway, that was my doctor was like, we waited. He gave me like another 5 days
Yeah.
and then he's like, well, what do you want to do? So then we ended up I induced one day and in 6 hours she was here and it was beautiful. And he was phenomenal too. And I think he was impressed with the whole journey and story because he's like, you tell me, I met him late in the game. So he's like, you tell me you were a really sickly person. He's like, but all your labs are beautiful, and I'm like, you should have seen them 3 or 4 years ago. This journey has been remarkable. And so I think what I tell everyone is they're like, are you afraid of like Lyme coming out of remission? Are you afraid of endo coming back? And I always just say like, well, if it does, I have the tools. Like we know what to do now. If I get another cyst, I call you or I go back to the drawing board. What did we do? Okay, go back to the notes. We do more castor oil packs. We do more proteolytic enzymes, more teas, whatever.
That's right. And then I also think too, and one thing that I meant to mention and forgot, is like in the program we do the Dutch test and the GI map. And on the GI map, we found a couple things too. I remember though too, Carrie was like, I've never seen such beautiful commensals, meaning the good bacteria, because of all the work you had been doing prior to coming to us. Your microbiome was actually like in exceptional shape, which is not what we
Yeah.
normally see. There was a couple little low lying like Citrobacter, which is like a histamine producer, and there was a couple things we added in. But at the time too, when you came to me, you were taking the GI Revive on a regular basis to help with healing the gut lining, probably from the Lyme community, right?
Yeah, so there was a lot of Cell Core is a great line that I love that I'd
We
use to
use it.
clean up my gut a lot. And in fact, this is what I tell all my friends who, if anyone has issues, the world is so toxic. Like we should be detoxing, right? Like all the time. So I plan when I stop nursing, I plan to do another big detox, maybe twice a year, because I mean, so many things, I mean, we're bombarded every day with everything, the chemicals and the things around us, and then we can't live in a bubble. So I think if we just continue to detox and kind of stay on that or cycle, and I'm trying to get my husband like, hey, let's do like a quarterly detox or a twice a year detox, because I've learned that, health can be a moving target. You're not just like you're healthy now and you stay healthy. Like it's something you got to maintain, and you can't just, and for the sake of, your kids and your family, I'm more functional. We can do all kinds of things now, fun things. I mean, nothing really gets in the way of what I can do now. And I was in a bad place before. I mean, where I didn't ever, I had stopped driving in 2020. So like there's so many, I've come so far, but I know truly, I don't think that
I
I
mean,
would.
I'm so proud of you too. I think you have just been so committed to your health.
Yeah. And I give
Sorry,
you so much
we
credit.
got
Oh,
where
are you?
I'm here. Are you here?
Okay. Yeah.
I feel
Yeah.
like
I'm
there
here.
was like a little hiccup.
Yeah. No, no, I give
No,
you so much credit, and I rave about
I
you.
mean, you were saying the same thing that I think I was saying, but go ahead.
Oh, just how I wouldn't have gotten here
Oh,
without.
well, and I also, I give you so much credit because I think you did so much for you, which was beautiful.
If you remember the list that so I took everything, your recommendations, and kind of put them into my notes in my iPhone. And I had like a daily list of like, these are the, 15 non-negotiable things I do every day, get first morning sunlight, 10 minutes, have and I think it's some of these things people think sound crazy, but here's the deal. It's like, is turning off blue light before 9 o'clock really that crazy? We didn't used to have that for thousands of years, so sometimes getting rid of some of the artificial lights and the things that are considered normal now, but aren't normal to our bodies, I think some of that is huge and makes big differences in our health. Did I lose you? Uh-oh.
Well, that's it. I want to read the list too, because I
Yeah.
have it here, but I agree. I mean, we talk about blue light all the time in our groups. I have my glasses, they're somewhere right here. I also changed every light bulb in my downstairs house, which is where we tend to be at nighttime, to a red light. It's like a warm light. They literally look like warm light bulbs, and you can find them on Amazon. They're great. But now so even if we have lights on, it's not blue. We're not getting the blue, we're getting the red, which I think is important. But yours were prayer, sunshine before noon, 20-minute minutes to do, reading 10 pages, acupuncture weekly, blue light blockers after 9, castor oil packs nightly, and gua sha, but not once you could be pregnant, breathing exercises, circle and blue meditations. You loved them. I love their
Yes.
meditations.
Yeah.
Um, sacral chakra healing guided meditation, your fertility prayer. So those were like all in your mix of things that you did on a regular for you and for your nervous system, I think, and for healing like that, the non-dietary emotion, like inflammation that's coming from lifestyle and emotions, right?
Right. Yeah, absolutely. And I didn't deviate a whole lot from that. It was just sort of because when you feel like there's not a whole lot you can control about your infertility, you have this list and you're like, well, at least I can do this. And then, like you said, like it's just staying the course, the gradual, the commitment to it. And things started to come together when I started to get pregnant, and I realized, okay, I'm going to be able to do this at some point. But was that month that I got pregnant, I was actually supposed to do the IUI, another IUI, and then IVF. We're going to do
Yep.
IVF. And because we were sick and had a fever, I remember telling you I was so snotty. I was taking a little Benadryl and I said, the doctor told me my IVF doctor, he's like, I don't think you're going to get pregnant this month because you had a fever and the body is working to get well. But I ended up getting pregnant and here we are.
I heard you. You just froze for a second.
Yeah.
But yeah, that the doctor was like, I don't think you're going to get pregnant this month. You had a fever and your body's working on other things. And then look at that.
Yeah.
And also to all those that worry about COVID and its impact on healthy pregnancies, healthy
Oh, for
baby.
sure.
I mean, you you have one here to show that it
Yeah.
wasn't such an impact, right?
Right. Yeah, exactly. So I'm very grateful. And I think I tell everyone I can about you. And I see that lots of my friends follow you now, which is awesome because I think the information that you're putting out there is invaluable and just, it's so hopeful. And I think sometimes hope is like 50% of it, right? And when you're telling, and then the rest is like obviously necessary, but you have to have that hope first, more than anything.
And I think too, it's like, I think about with you in your case, and like I was saying to you before we went live, of a lot of my stage 4 endos with 3 losses are doing autoimmune protocols, and it does get them to the finish line. I think with you, we were doing autoimmune protocol from lifestyle and supplement perspective, but we weren't on a full autoimmune protocol, meaning steroids and more aggressive blood thinners or anything, and it
No.
worked for you. And I think that's a big takeaway for a lot of people watching. And then also, I think the other big takeaways are AMH of 0.4, FSH in the 20s, low antral follicle count in her mid 30s,
Yeah.
and things improved. And she got pregnant naturally before starting IVF.
And I did this, yeah, and the CoQ10, you recommended
Yeah.
that, but I
Oh
was
yeah.
actually, what I realized is I was taking 700 the whole time because I was doing the 600 and then I didn't realize my multi had 100.
Yeah.
So in
Yeah.
total, so I think all the pieces kind of came together
And
and
and you did. I think the therapy that you were doing on your own. I mean, the one thing too that I always admired and really respected about you, and it I don't always see in all my clients because it's so hard to face, is how how diligent you were in facing the emotional challenges and the stress that was with this journey. And I do think that really facilitated you getting there faster. Yeah.
yes, it's been fun. It's been fun and interesting, but yeah, I just love you and I rave about you to everybody and I can't say enough good things about you. So
Same.
thank
And I'm just, I'm so happy for you. And I'm so grateful for you taking the time away from little baby and your busy life to come and share your story with everyone. So thank you so much, my love.
thank you. Thanks, Amy.
You're welcome to everyone.